Hey everybody, my name is Jordan Wilkie, and my central clinical phenomenon was decreasing patient anxiety through nursing care. This phenomenon is important because as nurses, it is easy for us to hear information or diagnoses and fully understand and be okay with it and be good with it and understand what's going on. But for patients, it's a whole nother story. If you don't care for the patient's fear, their pain, on top of addressing their lack of understanding or failing to communicate important details of their care with them, they have every right to be anxious and feel that way. It is our jobs as nurses to give proper pain management, communicate clearly, and give our patients the information that they deserve. Use less medical jargon, educate our patients, and give them all the information that we have at that time. If we get a test result back that we're able to give them the results of, or if we got a different lab back and they want to know what it is, if we know that information, we should be telling them that information. I had picked Peplaw's nurse-patient relationship theory specifically for this project because it was a theory that was used with psychiatric nurses. It is important to formulate this bond with your patient, to have that trust and therapeutic communication with them, to set them up for better health outcomes. By managing their pain, patients won't think that their condition is getting worse. By using clear communication, they will fully understand their discharge instructions, for example, and will feel less anxious about knowing what to do and how to do it. By using less medical jargon, they will understand more and feel less intimidated to ask questions of you and what they need to do. And this will decrease their stress and anxiety. And finally, by giving them updates, they will worry less about a test result and be able to eat dinner because they will be not as worried about that type of thing the whole entire rest of the night. All of this leads to better patient outcomes. So my question and final ask for everybody is, how as a nurse will you specifically plan to implement this to your practice? How will you use Peplaw's nurse-patient relationship to help decrease anxiety on your floor that you plan to work on?